So I am so honored to be here with you today. In this moment where yet again we're all trying to find the way forward with respect to the COVID pandemic and kind of what to do next and what's coming down the pipe. So as Brian said, just to give you a little more background about me, I'm a doctor by training in pediatrics and internal medicine, but really over the last 15 years, my career has really been in disaster response and recovery and health crises, both here and abroad. And right now, I'm running a program called COVID Academy at Harvard Medical School that really aims to, work with folks like you all, folks who are on the ground implementing COVID response, trying to figure out the way forward. And so, thinking about how I could be helpful to you today, I thought it would be good to spend some time really going through how the COVID vaccines were developed. So, what they do, what they don't do, so that you really feel like you're on terra firma as you're talking about these vaccines with your members, with your colleagues, with your workers. And I also thought it would be helpful to explain a little bit about vaccine mandates, what we've learned so far in their rollout with respect to other industries, and really talk to you about the public health case and the workplace safety case around the vaccine mandates. And then I really do want to open it up for discussion. I learned so much from Brian and company whenever we get together, and I really would love to hear what's on your mind, what questions you have, what thoughts you have about how things are going, and that would be really valuable to me. So I do have a few slides to share, and I'm going to do that just as we walk through this together. Let's see if I can do it in presentation mode without making it too. Oh, those fancy graphics here. Yeah. So vaccination is one of the oldest and most effective health promotion tools human beings have ever developed. Okay. So the practice of exposing people to mild or inactive or partial forms of a pathogen so they develop immunity to a more dangerous state of that pathogen dates back to at least the 17th century. We have historical records of it, of the Chinese embracing it in the 1600s, West Africa, Middle East. This is a very, very, very old technology, if you will. So I love military history. And one of the reasons I love military history is because behind every great military victory is a big health story. So maybe you recognize this fellow in the middle here from your $1 bill. That gentleman, of course, is George Washington. And America was really able to win the Revolutionary War because of a vaccine mandate that George Washington imposed on the Continental Army against smallpox. So in 1775, 90% or more of U.S. forces were lost. Their attrition was due to smallpox. It wasn't because they were being shot at by the British. And the smallpox was just sweeping through, camp after camp and debilitating soldiers. And in fact, really, the U.S., everyone thought the tide would turn in the war in Quebec when they had a battle in Quebec. But so many U.S. forces were not even able to make it to the battlefield because of smallpox. The U.S. forces lost, and George Washington said, "You know what? Enough. We are gonna inoculate forces by mandate against smallpox." And the British military had already done this. By and large, their soldiers were already protected from smallpox because they were inoculated or given a vaccine infected with a variola virus, which is a variant of smallpox, which is far less deadly. Interestingly, the Continental Congress had passed a law prohibiting vaccine mandates. And George Washington said, well, you can find another general because this is going to happen. And so they did institute the smallpox inoculation. And after that, there was not a single regiment that was taken off the battlefield due to smallpox. And of course, well, the rest really is history. They went on to win the war. So, what we're talking about when we're talking about vaccines is something very, very, very old. This is not something new. It's even older actually than filtering water. So, it's actually hard to think of another medical technology that is older than vaccines. And fortunately for us, the field of vaccine research has matured substantially since the 1700s, when they were literally infecting you with a disease. So I just wanted to show you. Here are all the vaccines that are available in the United States. The ones in red are mandated in most states to US school-age children. So you or your children have gotten every single one of these, most likely. And US military members, of course, get many, many more, depending on where they are deploying to. So all vaccines work by a similar technique. Okay, they expose people to a mild, inactive, or partial part of a bacteria or virus so that one's immune system can be trained to recognize and develop antibodies against a more dangerous form. Okay, so this approach works with people's immune systems. So for example, let's say you step on a rusty nail and all the dirt from the nail gets into your heel, all the thousands of bacteria and virus and fungi that live in the soil. So your immune system has essentially beat cops that are patrolling the body constantly and are on the lookout and are trained to recognize intruders. So when they encounter an intruder, they chop it into little bits, and they take these bits back to essentially headquarters or the lymph nodes, where they present these distinctive bits to their sergeants. And the sergeants in turn design and produce special weapons that latch onto and destroy the distinctive bits of the intruders. Okay, so this process takes time. And so if the intruder can replicate and spread throughout the body before the special weapons can be developed, well, a person gets sick and can infect other people. And in some cases, people are overwhelmed by the infection and die. So vaccines make use of this system, okay, by helping out the beat cops by showing them distinctive bits of a pathogen that they can take back to headquarters to kickstart the process. So COVID vaccines were developed very much in the same way that all vaccines are developed. The first step is to try to figure out what is the most distinctive and useful bit of the virus to show the immune system, to show the beat cop, so that it will develop the most effective and specific antibody, the most specific weapon against this particular pathogen. So researchers had started this process for coronaviruses after the SARS pandemic in 2002. So I don't know if you guys remember that, but in 2002, we did have a coronavirus pandemic with SARS, and came out of Asia, swept through Canada. We had several cases here. And this was really the world's first modern experience with a coronavirus pandemic. Most of the attention prior to SARS had really focused on influenza or flu, okay, a master killer of people during pandemics. So here's a picture. On the left here is coronavirus, and on the right is influenza virus. And you'll notice that on the influenza virus, there's sort of two different funky little spikes coming out of it. There's a light blue one and a dark blue one. And these are the distinctive bits of the influenza virus that are used to make the flu vaccine, okay? And so that's generally, every year though, flu changes how those little blue spikes look, just a little bit, but enough to make it so that your antibodies from the last either vaccine or infection don't work quite as well. So that's why you get a new flu vaccine, or recommended to get a new flu vaccine every year. But flu has this sort of superpower. Occasionally, it will totally change how those blue spikes look, so much so that your body doesn't recognize it at all, and the vaccine has nothing to do. The proteins in the vaccine don't look anything like the version of flu that comes out, and that's when you have a pandemic, and those are usually incredibly lethal. All right. So the last one, of course, that we've had was in 1918. So on the left side here is the coronavirus, and you always see it drawn with these red bits coming off the side, these red spikes, and this is what's called the spike protein. And interestingly, actually, as fate would have it, in November of 2019, I went to a health security conference, and these are conferences where you meet with people all over the world who are interested in biosecurity and health security, and then we spend the next like 2 weeks like scaring ourselves silly with all the horrible pathogens that can arise and all the fate that they can, the blows that they can deal to humanity. And my husband is often like, do you really have to go to these conferences? You're so upset after you go to them. But at any rate, I went to this one in November of 2019, and a team of coronavirus vaccine developers actually presented at that conference. And there they were describing how they had gone about identifying the spike protein as the best target, the best distinctive bit of coronaviruses to develop a vaccine against. So, however, after they presented, I found them in the bar of the hotel after that day, and they all looked really down. And I actually sat down with them. I was like, "Hey, what's why are you guys so down? It was a great presentation." And they said, "Well, actually, Margaret, all of our funding has dried up. We've made these incredible breakthroughs. We've identified the spike protein as what we would make a vaccine out of. And not only that, we have this new idea for how we could deliver this distinctive bit of about coronaviruses to the beat cops, to the immune system, that would be much, much faster. It's really interesting. It means that we don't have to cook up a lot of spike protein in the lab. We can actually give the instructions to the body to make spike protein, and we think it would shave months off the time for vaccine development. But all of our funding has been pulled, and so we're all actually breaking up our teams, and we're going to go to other labs." And I was like, "Why is that?" They said, "Well, world's really lost interest in coronaviruses. They really want to spend money on flu, but maybe somewhat, but they're not interested in coronaviruses. They don't think they're really, going to be important." So that was November 2019. Of course, that was 2 months before the outbreak started in Wuhan. But the reason I tell that story is so that you understand that all of the science was sitting on the shelf, okay, before the coronavirus, before COVID really started to take off. There's years of research that had gone into thinking about how to make a vaccine. So I want to also dwell a moment on the innovation that they were mentioning in that hotel bar, where they said that they had come up with this kind of new idea for how they could shave months off the vaccine development time and really give the beat cop of the immune system something to work with faster. And so what they were talking about was, of course, the mRNA approach to vaccines. So the reason that it was so sort of poo-pooed by donors, and the reason that their funding in some ways had dried up, was because mRNA is super, super easy to make in a lab. It's really cheap. It's really super easy, but it's incredibly fragile. It's a molecule that just is designed to self-destruct. So they thought, well, you know what? Let's put the instructions for the spike protein and code it in an mRNA, and that would be the vaccine. But really, people were like, that's just not going to work. So why do I say fragile? Why is mRNA so fragile? I think the analogy that's sort of helpful to think about is, you've all heard of DNA. So DNA is a hard copy, or it's a blueprint that's sort of etched in stone that you need to build a coronavirus or any other organic structure. And, DNA in a cell, for example, is this, it's etched in stone and it's in a locked room, the nucleus of the cell. And how builders build from this blueprint is they take a little piece of onion skin paper, super fragile paper, you can imagine, and they rub it over, make a rubbing of the blueprint etched in stone for just the part of the building that they want to produce. So then they take it outside of the nucleus and they build that thing, but that onion skin paper is sort of built to self-destruct because, you don't want to build a building 25,000 bathrooms or, 100 million shingles. You want just enough to sustain to have just the right number of parts you need to build the structure that you ultimately want to do. And so mRNA is extremely, extremely fragile, and so that you can not overproduce. However, it is stabilized if you keep it at a really low temperature. So that is what these folks around at the hotel bar were discussing. They're like, yes, we know it's a little new, but we really think that this is something we can do. If we just keep it at a low temperature, it'll give the body just enough time to be able to produce the spike protein, and therefore, have build up those special weapons against the spike protein for coronavirus. So I just say this again to say we had all the science sitting on the shelf when COVID hit. What was lacking was the investment needed to really finish the vaccine research and to test it. And so, and that's really what we provided, the US government provided in the early months of the pandemic. We kind of dropped everything and we put that investment into finishing that science and to seeing if it would work. And we were incredibly lucky that these vaccines did work and they're as safe as they are, sort of proving once again the maxim that luck favors the prepared. Okay, so that's sort of the story of the COVID vaccines, where they came from. I want to just say a word about how safe they are and how well they work. Really, when this data came out, I cannot tell you and emphasize enough what an enormous triumph it was, and the enormity of the relief that those of us that have been working on this felt. I mean, really, I was shed lots of tears when the data started to come out about how effective and safe these were. Of course, they were tested on tens of thousands of people. At first we really worried about how side effects are going to be monitored, and I have to say that was really done well. During the trials, there were daily check-ins with enrollees for 6 months. Okay, really going through with them. What were the symptoms they had? Any side effects that might have occurred? The CDC set up 3 independent reporting systems for vaccine side effects, both with independent providers through the pharmacies, and again with the drug companies that were developing these. So it was very robust reporting of side effects. The original vaccines reduced infection by 80 to 90% and reduced hospitalization and death by 80 to 90%. So it was a really stunning achievement. And I would also just like to note, in the whatever it is, 400 years of vaccine development, there is not ever a single instance of a side effect from a vaccine occurring after 2 months. Not one. So all those vaccines I showed you back there with the huge list, not one of them has had a side effect that's ever been, that has ever presented after 2 months. So, old technology, very prepared team that was investigating it, incredibly safe side effects, side effect profile, and really, really careful monitoring. So you know what? We raised our arms in victory, right? I mean, I'm sure all of you sort of back in the summer were like, okay, this is great. We've got effective vaccines. We've passing them out. Okay, well, some people might not like them, but hey, they're available. They're super safe. Well, there are a couple things up front that we didn't count on. One here represented on the picture on the right is we really didn't count on the amount of misinformation and disinformation that we were going to encounter here. Just really a flood of torrential flood of misinformation, suspicion, worries, etc. That was not in and of itself a surprise. That definitely happens with all vaccines. There's been a long history of that. But the degree and also where people turned to for information, I think we were caught a bit flat-footed, to say the least, about really countering that. And the other thing that I think we were not, we just being the general public health community, we really didn't understand was how depleted our public health systems in this country were. that we were going to count on our public health systems to be able to deliver these vaccines across the country was just not going to be feasible. So we had to come up with new approaches really to reach all corners and to be able to offer this in a fair way to folks. Okay, but those all seemed like we could deal with it. We would get over it. It'd be okay. But COVID really wasn't done with us. Okay, and this is a picture, of course, out of India last spring with the Delta wave. And COVID had, by spreading through to billions and billions of people, had started to mutate. And what part of it had it started to mutate? It had started to mutate its spike protein. So the spike protein started to change shape with all the replication and transmission that was happening, to the point where, first of all, it was able to transmit much faster, and it was able to make people sicker. And not only that, it started to show some that our vaccines were potentially going to not be as effective against it. And that was a huge game changer. Okay. That's when we started to say, wait a minute. We had really been viewing vaccination as sort of a personal choice. You get vaccinated, you protect yourself. We'll protect the vulnerable. If you decide that this is not for you, I'm going to stand here and try to convince you otherwise, but it's really kind of up to you. But now something was different. Now it meant that if people were not getting vaccinated, COVID had more chances to transmit, to spread, and thus to mutate, and was going to mutate out of our vaccine coverage. So an individual's choice not to get vaccinated was actually going to reverberate to the people that were vaccinated, because their vaccine might not protect them as well. So it's like, if you allow your house to burn, okay, fine. But hey, if it starts to catch my house on fire, that's going to be a real problem. And that's really where we, basically took a body blow as a public health community, where we had to say, wait a minute, the name of the game is slowing transmission as much as possible. So again, just the spike protein again is what is changing its shape. And that's the concern here with continued spread. So we really have a new mission on our hands as of the summer, which is to slow transmission as much as possible. Okay, so to decrease the chance that you will spread to others, but has become the reason to get the vaccine, and to decrease the possibility that new variants that are more deadly and more transmissible will start to emerge. So that's really where this conversation around mandates started to really gain momentum. Like, a lot of folks that I had worked with were very skeptical about mandates. They really were like, oh, come on, we can convince people if we just hang in there with them long enough. And I had very mixed up feelings about it. But I think that this issue around transmission, really started to really frighten us here. And so I just wanted to throw up here, as of August, these were all the companies that started to, to embrace vaccine mandates. I think it's interesting how many folks who are in financial services did this, because you can start to see where people with concerns about what COVID is doing to the economy started to really see this as an imperative, as well as really large companies. I mean, Walmart, Amtrak, Salesforce, the airlines, United was probably the first out of the gate there. And so in preparation actually for this call, I did do some calling around to talk to folks that had helped some of these companies stand up their vaccine mandate policies. And I learned a couple of things I'll just share with you. First of all, what we know to date about vaccine mandates is that they are incredibly effective. That workforces are going from anywhere from 40% coverage to 95% coverage. The fraction of people who are opting out is, usually less than 1% of workforces for religious exemptions or for, continued concerns that they have. And so it is working really well. I asked folks like, well, why do you think they work so well? And the explanation that I got that really rang true for me was that it really just took the emotion out of it, and it also signaled to people in and of itself that, hey, this is serious, and we really need you to take to prioritize this. And it really rang true for me because, as I've mentioned to Brian and others, I have had a vaccine mandate in my job for 10 years, where Brigham and Women's was like, hey, you got to get a flu vaccine every year. And I will tell you, I did not do it. Okay. At first I was like, oh, I am busy. I have so many other things in my life. Okay. All right. Then they said, well, okay, you have to fill out a little form. And I was like, okay, sure. I'll just click the exemption. In the first year, and it wasn't until they said, you are going to be fired if you do not get a vaccine by this date, that I was like, oh, okay. Oh, well, okay, sure. And sort of thinking about why I made that choice, I think, it's funny, but doctors really have this kind of, I don't know, machismo kind of attitude. Well, training, it's like, the patient always comes first. It's never about you. You don't take care of your own health, just take care of patients' health. And it's why doctors make the absolute worst patients, right? We just, this sort of mentality that, you don't eat, you don't sleep, you don't take care of yourself. You just are all focused on patient care. It really did not occur to many of us in our little brains here that we needed to get the vaccine to protect our patients. It wasn't until that was really underscored and highlighted by our bosses that we really took it seriously. So I think that sending the signal that this is important and it's safe, and I wouldn't ask you to do it unless it mattered, is really a powerful social dynamic at play with mandates. I think the other thing that comes up is people are like, yeah, okay, only 1% are resisting, or don't want to get it, but they are my most important employee. They're really, really critical to my effort. And here again was something that was really interesting that I learned from folks that had helped with the mandates. They said, without the mandate, employers had really no entree to go and talk to their workers about vaccines. I mean, yes, they could stand up and say, hey, I hope you get a vaccine, it's great. But without really having a option for like a reasonable way to broach the conversation, it was quite difficult. And they said the mandate really forced management to say, have conversations with employees really often toward the side, saying, hey, we need to make a plan for what to do when we need somebody else to cover your work because you are not vaccinated. How are we going to make that plan together? And then, wait, okay, what's going to happen here? And sort of engaging in that conversation, either about how their shift is going to be covered or how they can possibly be accommodated through testing. How are they going to explain to the people that they're working with that they are not a risk to their own, to others' safety? And really having it be a workplace safety conversation rather than an individual choice conversation or a nice to have conversation was really where the mandate effort has really changed the dynamic. So we do see, a tremendous effect. I do think that there are a lot of worries about what's going to happen to the small sliver of reluctant employees. I would say that, having the conversation is a very powerful thing in and of itself. And then also, you can offer reasonable accommodation to people. And this is where I know Nikki Decter has been so invaluable in helping to figure out how that's going to work. So just to say, we have paid a terrible, terrible, terrible price already with COVID, and COVID is it's just not over. Okay. So, 700,000 dead, 5 million at least worldwide, enormous cost to our livelihoods, to our supply chains, to our daily rhythms of life. I was talking to Brian a little bit about, specifically for the construction industry, what has been suffered and lost. I mean, and it is shocking. The loss of productivity, the delays in projects, the financial penalties for delays, the public funding slowdowns, the health funds depleted with every COVID case costing a health fund around upwards of $6,000, and then not necessarily being replenished because of reduced work hours. We can't keep taking body blows as a community, as an industry, as a nation like this. We have to step up and we have to get some protections in place. And vaccines are the obvious and easiest and smartest answer. They're quick, they're effective. They are simple in some basic way. It's a lot simpler than having to test everybody every 2 weeks for time immemorial, having to constantly fight with people about keeping their mask over their nose or what have you. It's a one shot deal or 2-shot deal. I would say that we kind of need to lean into this moment and saying, we really have to embrace our inner George Washington. Enough. This is enough. Okay, we've taken enough hits here. And now we just need to be a practical people and get the job done. And so I think, vaccines and vaccine mandates are, a very, very solid path forward.